If your child has autism, there's a 98% chance that they have an MTHFR gene mutation, and that could be affecting their symptoms. And yet, doctors don't really even test for this or tell you what to do about it. So, today I'm exposing that critical connection, and we're going to talk about it a little bit. So, hi, I'm Danielle Orr. I am a family nurse practitioner, a psychiatric mental health nurse practitioner, and a functional psychiatry coach. And today we're going to dive into the research that could really change everything about how you approach your child's autism and the connection between the MTHFR gene mutation and autism spectrum disorder. It's pretty science heavy, but it's incredibly practical. And it's something that I want to make sure that we kind of dive into. So stay with me because this information could be something that you're missing with your child's treatment. So let's start with the facts. Multiple studies have actually found that children with autism have significantly higher rates of MTHFR mutations compared to the neurotypical child. So in 2012, a study published in the Journal of Autism Development Disorders found that 98% of children with autism had actually one MTHFR mutation variant, which is compared to the 40 to 60% in the general population. So basically, kiddos with ASD have a higher chance of having that variation or the gene mutation versus the general population. So that's kind of significant. So another study actually showed in the American Journal of the Medical Genetics found that mothers with MTHFR mutations have actually have 2 to 4 times higher risk of having a child with autism, especially if they have low folate levels during their pregnancy. So these are things to just be aware of. It's really important to remember that these just aren't random correlations. We know that there's a biological mechanism that connects the MTHFR mutations to autism symptoms. So let's talk about what those mean. So those MTHFR mutations actually can affect your methylation, which is really crucial when we're talking about depression and brain development and talking about also like just gene expression in general. The neurotransmitter production, which is the things that cause, mood issues or behavior issues or social engagement. It also is important in detoxification. So it can affect the body's ability to actually clear some of those environmental toxins. So if they're getting those environmental toxins, they're not able to actually clear them through because of that gene mutation. Something else that's really important or that it can affect is oxidative stress. So it can cause increase of inflammation in their brains, which again, we talk about when we have inflammation in our brains, there's lots of behavior issues that happen with that. And also neurodevelopmental. So this can affect how our brain is formed and how it functions on a daily basis. And so these are all things that are processed differently with kiddos with autism. The MTHFR mutation doesn't actually cause autism by itself. So I don't want you to think that's what I'm saying, but it can actually create some vulnerabilities that combined with other genetic and environmental factors can contribute to autism development and severity. So again, I'm not saying that it causes autism, but what I'm saying is it can contribute to some of the different things that are happening with an individual with autism. So let me break down exactly how the MTHFR mutations affect specific autism symptoms. Something to look at is the social and communication challenges for our kiddos. So methylation is really crucial in producing the neurotransmitters like serotonin and dopamine and oxytocin, all of which are really involved in that social bonding and communication and emotional understanding. And so kiddos that have that mutation, they can't really produce the adequate amounts of these neurotransmitters, which is directly affecting their ability to read social cues, engage in kind of that reciprocal conversation and form emotional connection and also really regulate the social anxiety. And I have a lot of kiddos that I work with that these are daily struggles that parents talk about. And so when we're looking at the connection, it's like, oh, well, maybe we need to work on these pieces, right? So it's something else that it affects is the social processing issue. Because when you have the MTHFR mutation, it actually affects how the nervous system is processing that sensory information. Like, how is it being digested once it's coming at the kiddos? So really, a lot of our kiddos that have the gene mutation and autism, they have a heightened sense of sensitivity to sounds and lights and textures. They have a hard time censoring the different noises around them. And also they have that sensory overload, which really can lead to meltdowns and things like that. And with coming with the sounds and the light, when it's really a lot going on, they can't filter it out, right? And so that's really an issue for them. And this is happening because the methylation is actually affecting the neurotransmitters that balance the nervous system regulation. If we're having issues with balancing that out, we can't filter. Like, how do you expect them to filter if you look at it and it's kind of like an air filter that's dirty and it's not filtering the air correctly? It's just you're swimming upstream and it's not working very well. So something else to think about is that behavioral rigidity and repetitive behaviors. Again, a lot of symptoms that our kids with autism have. These symptoms are usually related to low serotonin and dopamine, which really both of those require the proper methylation production. And if you're not getting it with those mutations, it can lead to increasing anxiety that can drive those rigid routines, dopamine dysregulation, which can affect the behavioral flexibilities. Like they're just super inflexible with something. I'm not going to do it. It's not happening. Not today. And then difficulty with transition. So these are all big things that we talk about all the time with kiddos with autism. Like I said, something to think about. Another one is GI issues. We know that there's a lot of correlation with GI issues in autism. And that's something that people don't really know. I guess I say we know, but really like 70 to 90% of our kiddos with autism actually have GI issues. And the way that the MTHFR mutation can actually contribute to that is because you need methylation in order to cause that detoxification and getting the stuff out that we don't need. It helps them take that trash out. So if we're having poor detox, then it's leading to gut inflammation. And we're having gut inflammation, then we're just backing up things. And really with the methylation, it actually affects our immune function in the gut. And so it can lead to more inflammation in our gut. And really a lot of our kiddos with MTHFR variants have a histamine intolerance. And so that can be something where, again, histamine can cause more inflammation, irritation, agitation in the gut, which then also causes the gut issues. Another thing that we know that I talk a lot about with my parents is the sleep problems. Sleep problems with autism are very highly correlated. And so when we're talking about what could potentially be causing those, you really need melatonin to sleep. So I'm not saying you have to supplement melatonin. What I'm saying is your body naturally produces melatonin. So melatonin production actually doesn't happen if you're having poor or improper methylation. And so children with the MTHFR mutation actually struggle to produce an adequate amount of melatonin, which can lead to trouble falling asleep or frequent night waking or getting up really early in the morning. I can't tell you how many times I have parents like, they're up at 2 a.m., they won't go back to sleep, or just general sleep, like poor sleep quality. And so that is really important that if our body's not properly producing it, that can definitely cause an issue with our sleep regulation with our kiddos. And then also the sleep and language delays. So methylation is really crucial for the brain development and the myelin formation. So the mutation can actually affect things like the neural pathway development, brain connectivity, language processing areas, and just ways that communication is lacking sometimes for our kiddo or delayed. It can definitely be related to any kind of methylation issue. There was this kiddo that I worked with once. He was a 5-year-old with autism, nonverbal. He'd been in speech therapy for many, many years. And we ended up testing for the different THFR gene mutations and seeing like what was going on with him. And we found out that he had a variation in his MTHFR and he had very low methylfolate levels, which means that he just wasn't processing it correctly. And so we started supporting him in that way with the right nutrients, and we addressed the gut health and reduced his toxic load. And he actually did speak his first word. And it's amazing that he was able to get that working and he was able to put the sentences together and able to speak them. And then even now, about a year out, he's speaking in some short sentences, which is amazing. And it's things like that that I'm like, yes, there is definite connection. And a lot of people are like, oh, well, they just need more speech therapy or they're never going to talk like that. I don't know about that. I feel like we just need to give our kiddos the proper tools. And sometimes that's all they need to succeed. So I'm always about finding different ways that we can work with our kiddos to succeed. So that was just one little story. Everybody's different, but that was a cool story that I wanted to share with you guys. All right. So let's talk about the environmental trigger connection. What does that mean? So basically, when anybody has a variant in their MTHFR, this becomes critical because what happens is individuals and children with this mutation, they actually can't detoxify environmental toxins very effectively. And so sometimes what that shows is that our kiddos, when they're lacking that detox ability, the research is showing that they can sometimes have higher levels of heavy metal or things like mercury and lead, increased exposure to environmental toxins, obviously, because they're just not able to filter it out. And also the reduced ability to really clear those toxins because their body doesn't know how to get them out. So what happens is it actually impairs the phase 2 of the toxin or the detoxification process. And then as they're compiling higher and higher, they're leading to more like oxidative stress and just greater inflammation, and which can cause worsening symptoms of our kiddos. And this is why sometimes our kiddos, they seem to regress after a certain exposure. Like their bodies just like literally can't handle the toxic overload. And so maybe they've been around a certain place or a certain environment, and all of a sudden you're like, well, they were doing okay, and now we're having like more inclusive behaviors or things along those lines. But really, if you actually support them with the proper way to methylate and to detox, then really you're going to see less of a toxic burden and more improved symptoms. So, if your child has autism, there are definitely some testing processes that I recommend, and really just not testing for like the MTHFR functionality. We want to know exactly what's going on, the different variants of it, right? So, there's genetic testing that can look at that. It can look at the MTHFR variants. It can look at like your COMT, just different ways of things that are working through the process of the methylation component. Also functional testing. So looking at our plasma homocysteine, our methylfolate levels, our oxidative stressor markers, toxic load assessments, and your basic blood panels can also be helpful. And so there's lots of different ways that we can look at that. And when we're looking at the genetic testing, it actually can tell us like what variant your child has of MTHFR, which is really important. Like it can tell us like, hey, this is what's affecting our body. And really all of these pieces together, it's like a puzzle piece, right? It's actually the most beneficial way to create an effective treatment plan and a treatment protocol for your individual child. And so this is something where I'm like, hey, getting that protocol is so super important for our kiddos because it's so unique and it all is different for our kiddos. And ways that we can help support that once we figure out what's going on. Obviously, everybody is different. We can help with giving them certain methylation support. We can work on reducing the methylation draw with things that are causing you to be needing more methylation or gut inflammation, toxic environments, food sensitivities, those kind of things to help just decrease that need for everything, picking up all the things that need to be methylated. Detoxification, working with your body's ability to detox and clear toxins is really important. Also, addressing coexisting issues. Are there other things that are going on? Are there sleep issues? Are there gut issues? Is there more immune support issues? Things along those lines. So it's really important because when we're able to work through that, we can figure out how to best approach things with your child and we want to help them live their best life. And so it's one of those things where we have to also consider that not everybody can do that, right? And so you need someone that knows how to help support the MTHFR variations and the gene mutations with an experience in autism is also very important. And the biggest thing is if you have a practitioner that's like, all right, we're going to do all these things right now. It's one of my biggest pet peeves in pediatrics and children in general, slow and low. So that's always been my thing. I've always learned because I've been in school. So we want to start low and go slow. Because the other thing we have to remember too is our children with autism are actually very sensitive to methylfolate. And so starting doses too high can actually cause irritability, hyperactivity, sleep problems, which really is everything we're trying to reverse, right? And so you're being counterproductive with that. Obviously, our kiddos need to be monitored closely. And really, we need to address the whole picture of what's going on. Because if we're not addressing the whole picture, then how do we know what's actually helpful? And as far as other things go, we want to make sure that we're working with a qualified practitioner. This is definitely not DIY. Like, I got this. I'll just watch a few YouTube videos. I'm not. This is why I keep it very broad in this video because I'm not going to sit there and give specific medical advice because every child is unique and different. And so it's really important that we are thinking about that and working with somebody who knows what they're doing. So I'd highly suggest that if you have a child with autism and you want to get their MTHFR possible mutations identified and investigated more, it might be the missing piece. This is something that I can definitely help you with because I use comprehensive genetic testing and functional testing to see exactly like what your child's lacking and needing. We can work on those things. So there's a link in my description to book a consult. We can discuss your specific needs for your child and go from there. So remember, MTHFR mutations are found in nearly every child with autism, but most families actually never hear about it, right? From their doctors. And so when we support the methylation process properly, then we can see improvements in their communication, their behavior, their sensory issues, their sleep, their GI function, all of those things. So your child's autism diagnosis does not define their potential. We actually need to address their underlying biochemistry and see what's going on so we can help them make as much progress as possible. If you feel like this was helpful, please like and subscribe. And thank you for watching. And I hope that you have an amazing day.